I'd really like to welcome everyone to Double Discrimination and Twin Pandemics, Women and Girls Addressing Gender-Based Violence During the Pandemic. My name is Carrie Thompson, and it is my great pleasure to introduce to you my colleague of 13 years, Disability Rights Fund Founding Executive Director, Diana Stamarison. Over to you, Diana.
Thank you so much, Carrie, and good morning or afternoon, really, everyone, depending on where you are. Good evening. Thank you for joining us at this side event to the 13th Conference of States Parties to the CRPD. It's the last day of side events, so it's wonderful to see so many people have joined us. I hope you all had a wonderful celebration of International Day of Persons with Disabilities yesterday. And I hope many of you are also involved in the ongoing 16 days of activism against gender-based violence. I'm taking back orange from a certain US political leader and wearing it today as a symbol of a brighter future free from violence against women and girls. I will repeat now a couple of important logistical notes that my colleague Carrie was talking about just before I started. We are using international sign interpreters who are switching out during the session. And we are also using captioning, which you can access at the bottom of your screen or via the stream text link in the chat. We have a number of speakers today, and they've been asked to limit their interventions to no more than 5 to 7 minutes each, to leave time 15 minutes at the end for question and answer, which my colleague Faith Lemon will be moderating. We ask participants to enter any questions or comments during this session into the Q&A or the chat so we can address them at the end. And we are recording this session so it can be sent to participants afterwards and also broadcast on the UN Web TV. With that stated, I want to warmly welcome you to this side event titled Double Discrimination and Twin Pandemics, Women and Girls with Disabilities Addressing Gender-Based Violence During COVID-19. This is a co-hosted event between the Disability Rights Fund and Disability Rights Advocacy Fund, Women's Rights Funder Purposeful, Women Enabled International, and Humanity and Inclusion's Making It Work Gender and Disability Program. We 4 organizations have come together with organizations of women with disabilities in the Global South, also represented as panelists here today, to talk about the work we are all supporting to address an increase in gender-based violence against women and girls, and particularly women and girls with disabilities during the pandemic. I am, as Carrie said, the founding executive director of the Disability Rights Fund and Disability Rights Advocacy Fund, which are participatory grant makers supporting the disability rights movements across Africa, Asia, the Caribbean, and the Pacific. Since 2008, we have given out more than $38 million to organizations of persons with disabilities across 34 countries for rights advocacy to advance rights of persons with disabilities, including at the intersection of identities like gender identity. Approximately 15% of all our giving goes to organizations of women with disabilities, and the top priorities our grantees are addressing are violence, access to justice, sexual reproductive health rights, and access to education. What you will hear today from all of us is not only more information about what women and girls with disabilities are experiencing during the pandemic and how they are addressing and fighting back against violence, but also how we are all using this time of lockdowns and quarantines to grow partnerships with each other and across movements in order to strengthen the broader feminist movement and the disability movement by supporting women and girls with disabilities as leaders and participants. I am grateful to all the women here today and to the women in our co-joined movements who are finding innovative ways to connect, co-fund, and co-support women and girls with disabilities who are survivors of the pandemic and of violence and of inequality. I'm also grateful to all the supporters and partners of DRF and DRAF for your steadfast belief in our work. And I am excited that these supporters include an increasing number of women's rights donors. With that said, I would like to introduce the next two speakers, who are both DRF grantee representatives. The first speaker is Gaudence Mushimiana, the Executive Director of UNABU, the National Organization of Women with Disabilities in Rwanda. Gaudence co-founded UNABU in 2004, and I'm proud that DRF was their first foreign donor. Gaudence also represents women with disabilities from Africa in the Executive Committee of the Commonwealth Disabled Peoples Forum. The second speaker after Gaudence is Malani Rotinsulu, the chairperson of Himpunan Wanita Disabilitas Indonesia, the Indonesian National Association of Women with Disabilities. Malani's organization is also a longtime grantee of DRF and DRAF, and they've been leading incredible coalitions addressing the rights of women with disabilities, including the rights of very marginalized groups like women with psychosocial disabilities and Indigenous women with disabilities. Both Gaudence and Malani have grown their work with the broader women's rights movements in their countries, including now during the pandemic, and I'm excited that you'll hear from them. Gaudence, the floor is yours.
Thank you, Diana. I'm Gaudence Mushimiana. I'm the Executive Director of UNABU, Rwanda Organization of Women with Disabilities. This organization was created by and for women with disabilities to enjoy equal and equitable opportunities, and actively they can participate in the country development. It's a self-advocacy organization that was created after realizing that women with disabilities had no voice among both disability organizations, but also among women's organizations. Women with disabilities are usually the mostly targeted by violence perpetrators who take advantage of persisting barriers in communication, attitude, and of course, justice system. COVID-19 multiplied the risk of discrimination and violence for women with disabilities because networking opportunities were reduced as they were not able to join their safe spaces, but also UNABU staff worried about the impact of the lockdown, that even when affected, their families and the community may not appropriately support those girls and women with disabilities who were confined in their homes because of COVID-19. We therefore, to make sure that we are supporting appropriately those girls, quick assessment to understand the experience of girls and women with disabilities. And with the assessment, we found that 83% of girls and women with disabilities who participated in the assessment reported that COVID-19 had differently affected their livelihood, their social, their emotional life, whereby they were not even able to access the basic services like health, sanitation, food, sexual reproductive health, and even justice when it was needed. I can say that the risk of violence has mostly increased, especially for those girls and women with disabilities living alone, and or their houses were like isolated from others. Many of them reported the fear of sexual violence because the movement around their home, the movement in their houses was restricted, and therefore perpetrator may took advantages of the situation they were going through. Girls and women with disabilities who survived just because of the support of their neighbors were like economically and emotionally affected, where they reported reduce in support because everyone was staying in home, but also the supporters have limited capacity to feed their household members. UNABU community mobilization officers, UNABU volunteers, to make sure that we are supporting those girls and women with disabilities at the higher risk of violence. Continue the organizing visits to girls and women with disabilities in their homes with attention to the already known as victim and or at higher risk of violence. To provide emotional support to ensure that needed they can access services, including to ensure they can access services for victim to access justice. But also we initiated a new working relationship with local authorities to ensure where we are not able to meet to appropriately support girls and women with disabilities, at least they can be supported by the local structures. I can say that COVID-19 also increased the opportunities for partnership and advocacy for inclusion of women with disabilities in the COVID-19 recovery plan, but also partnership to support disabled women affected by COVID-19. We are glad that we had new partners, new donors to make sure that we respond to the basic needs like food, like assistive devices, and even support their economic activities, where we are now able to train some our self-advocacy groups in financial literacy, in business skills, but also we provide seed capital to make sure that their economic status after COVID, post-COVID situation, they can survive, they can sustain their self-advocacy group. Thank you, Diana.
Thank you, Gaudence. Thank you, Gaudence. And I will call on Malani next to give her presentation. Thank you, Malani.
Thank you, Diana. Good day, everyone. This is Maulani Rotinsulu. Greetings from Indonesia Association of Women with Disabilities, and I would like to share our work on Organization of Women with Disabilities approach to ensure end of violence against women and girls with disability in COVID-19, where this topic is of crucial importance. The rise in gender-based violence during the pandemic noted that other panelists is in Indonesia set in a context of historical high rates. The pre-COVID data indicate that one out of every 3 Indonesian women experience violence. In 2019, Indonesia National Commission on Violence Against Women reported an increase in sexual violence against women with disability. So of the 142 recorded cases of abuse against women with disabilities documented by the organization, by HWDI, that the majority were rape cases is 33%. This This problem is vast because sexual assault and abuse against women with disability is often not reported. Most of the perpetrators in those documented cases were family members, friends, or neighbors who were known to the victims. Of the cases of sexual violence against women with disabilities that are actually reported, only half were legally processed. Some 20% of sexual violence cases end up with the victims being married off to the perpetrators. In our fight to change those statistics and protect the rights of women with disabilities in the pandemic and beyond, there are many positive developments to share. But first, I believe it is important to give you an accurate picture of the reality facing by Indonesian sisters. For example, a woman with an intellectual disability reported to HWDI Yogyakarta that she had been raped by a neighbor, suffering a fractured hip bone and severe trauma. The police collected evidence, including the woman's dress torn during the rape and the result of sexual assault forensic exam. But because of her intellectual disability, the police said her story was inconsistent, that there was not enough evidence to make an arrest. This case ended with the police demanding that the women's family apologize to the neighbor for defamations. So HWDI has been addressing this crisis from many different angles over the years. And many of those efforts have laid the groundwork for protecting the rights of women and girls with disability to live free of violence, even and especially during an emergency era like this. For instance, advocacy to the Ministry of Women Empowerment and Child Protection led to the establishment of Disability Desk Service. This Disability Desk Service providing support for women with disability and children with disability impacted by the violence in women crisis centers in 6 provinces, and gain a commitment from the Ministry to scale this program at the center across the country. HWDI also entered into the 5-year Memorandum of Understanding or MOU with the National Police to integrate a disability perspective into their work, audit the accessibility new police station, and advise on the standard operational procedure or SOP for the local province police station. At the onset of COVID, HWDI collaborated with Indonesian Service Provider Forum to collect data of gender-based violence through a focus group and surveys. The focus group discussion was hosted online with the 21 women with and without disability from 8 provinces, each of whom provides support for girls and women who are victims of gender-based violence. The online survey received 50 responses from 14 provinces through the online focus group and survey. Certain themes emerged about the gender-based violence against women and girls with disability in Indonesia. Some others is 80% of survey respondents experience violence occasionally, and 4% experience violence almost daily. And then second one is psychological violence in the form of humiliations, 48%, and physical violence through beating, 10%, were most common. Those who experience sexual violence reported that 70% was in the form of sexual harassments, 15% rape, and then 10% sexual exploitations. The third is 68% of respondents did not report to their cases to the police due to the stigma and lack of support. And most of GBV or gender-based violence victims assisted by women providing legal support are girls with intellectual disabilities. And the perpetrator is usually someone close to them. Women with disabilities, particularly blind women, are often not believed by police when they report their cases. And then the last is one with disability who provide legal support face also stigma from the victims' families who frequently do not believe that they have the capacity to provide useful assistance. So this data made it clear that the emerging double pandemic warranted concerted cross-movement effort. Through one of our current DRF grantee project, HWDI is also coordinating a virtual coalition of women's-led DPOs and women's rights organizations engaging in gender and disability inclusive COVID-19 advocacy to address gender-based violence from the multiple angles, including policy advocacy and engagement with the national policies. So the growing coalition include local HWDI chapter from Lampung, Bengkulu, Bandung, Sulawesi and Maluku, DRF grantees, the Indonesia Mental Health Association, and the Center of Improving Quality Activity in Life of People with Disabilities, member of forums Pengada Layanan, so Service Providers Forum for the Law, and also a network of 112 organizations that support gender-based violence survivors and women's rights activists. Since launching in June, the coalition has undertaken the following efforts. First is development a policy brief highlighting the increased prevalence of gender-based violence against women and girls with and without disability during the COVID-19. The outlining specific steps Indonesia government and humanitarian actors on the ground must take to ensure gender and disability inclusive response. While there have been many of these statements globally, this was the first specific to the Indonesian context. The second effort is launching a multimedia campaign aimed at the preventing gender-based against women with disabilities and providing accessible information about available resources for the survivors. An infographic also developed as part of this campaign. It is currently being used for the advocacy targeting governments, official, and the National COVID-19 Task Force. The third is supporting effort by Indonesia National Police to improve the accessibility and effectiveness of gender-based violence reporting mechanism, protection of the survivors and their children, and linkage to the available resources. This work builds on, yeah. One second.
You're going to have to wrap up so that we can get to other speakers.
Yeah. Sure. So while the COVID-19 has presented enormous challenge so far, it has also built solidarity and increase of effectiveness of partnership that HWDI and others have been building with the mainstream women rights actors, leading to the effective coalition I just described. We are working to ensure that this momentum create the pandemic will last beyond it and strengthening our collective advocacy on priorities such as overturning Indonesian Bill of Sexual Violence Elimination, which deny women with intellectual and psychological disability of their sexual and reproductive rights. So finally, significant challenges remain in the fight of end violence against women with disability in the pandemic and beyond. But we have greater strength to overcome them in solidarity with our sister and the mainstreaming women with disability movement. I thank to this sustainable advocacy and service work was supported by the Disability Rights Fund and Disability Rights Advocacy Fund. And I thank you very much for your attention. Sorry to take you a long of your time, Diana. I get it back to you. Thank you.
Thanks so much, Melanie. And you at HWDI are doing so much work. It is amazing that you could speak about as much as you did today. So thanks so much for your summary. I want to next introduce Zanella Sibanda. Zanella is Director of Programs at Purposeful Within for Girls Fund. Zanella is originally from Zimbabwe and has spent time in Chicago working on social development and racial justice. She also worked at Firelight Foundation and headed their strategy to provide long-term funding to grassroots organizations. I'm honored that Zanella has also worked with DRF over a number of years, covering gaps in our program team during some of our grants review processes. Zanella will introduce Purposeful's Global Resilience Fund for Young Women and Girls, which both DRF and Women Enabled International have partnered with this year to ensure inclusion of young women and girls with disabilities. Zanella, the floor is yours. And you have to unmute yourself.
I always forget. Thank you, Diana. My name is Zanella Savanda, and I'm here as a member of the team at Purposeful Foundation, and really pleased to share a great effort that came together in response to COVID-19, which over the course of the last 9 months has had great success in reaching resources to girls and young women with disabilities. So Purposeful is a feminist fund focused on supporting adolescent girls to have access to resources, to platforms and networks that allow them to push back from the systems that hold them down so that they can live a life of dignity, health, and safety. So when COVID-19 hit, we knew from other pandemics that often in these situations, girls often bear the brunt of a pandemic. The combination of the health as well as the economic crisis was likely to exacerbate all the ways that girls, because of their gender, because of their age, and because of other identities, would make them increasingly vulnerable, especially to gender-based violence, as we have heard from the other speakers. And so for sure, the data started coming in from across the globe, and we started to see that not only were girls facing increased violence, but we also know that they had limited access to resources and services as most countries went into lockdown. But we also knew that girls were responding to the situation they were in with courage and with grace. They were standing up against the violence, organizing and making an effort to ensure that they could support each other and stand up for each other. We also knew that within this context, within even an ordinary context, girls with disabilities face even greater risks, greater vulnerability, and that like all girls, their risk would only go up even more during the pandemic. And so what we knew was that if we could get resources to girls, we knew that they would be able to prioritize what they needed at this time. A conversation between Women Win and Purposeful seeded the idea of the Global Resilience Fund, a partnership between social justice funders committed to resourcing young women's activism. The fund grew very quickly and organically, and today has more than 24 partners, has raised over $1 million, and distributed over 200 grants to young women and girl-led groups in 91 countries. Funding includes resources to 24 groups of young women and girls with disabilities. And across the globe, they have been coming together to do and to act on behalf of themselves and of each other. A young women's indigenous group in Chiapas, Mexico, came together to fight against violence and discrimination that they face as young women with disabilities. They support young women with disabilities who are survivors of violence so that they are heard, they have access to services, and that they get the support they need to heal. A young group of women and girls with disabilities in Kyrgyzstan is supporting other young women and girls with disabilities to learn new skills so that they can earn an income through online work. Most of these young women were earning income through making crafts, but as lockdown really reduced the opportunity for them to sell those crafts, they needed to find other lines of income. And this group has responded to the situation by finding new opportunities for their peers. Another young group of girls in Nigeria is working to make sure girls with disabilities have access to face masks, access to medical services, and also access to the basic needs, as opportunities to access those services becomes harder and harder. Girls with disabilities who are often invisible to in situations of crisis face an even greater hurdle. So how did the Global Resilience Fund achieve so much in such a short time? I think there's two things that the process paid attention to, as well as the partnership created. First, just a few points on the process. One, we really focused on lowering the barriers to funding and making sure the application was simple, but also because of partners like DRF, as well as Ford Foundation, we also made sure that the applications were accessible. And therefore, it made sure that we were not leaving out girls with disabilities. Second, this is a participatory fund, and the decisions of where the resources are awarded was done by a group of panelists of young women and girl activists from each region where the funding was made available. And so we also made sure, again, by tapping into the networks of the partners, that the panelists included young women with disabilities to be part of the decision-making process. Therefore, the distribution of power of resources was inclusive as much as the access to the funding was as well. We also ensured that the process of getting to know the organizations was facilitated by the partners, and therefore we could draw on the different partners who were part of this process. And throughout, we always kept an eye on addressing the practical barriers that young women faced through this process. And I'm pleased that we can hear from Marcelina, who is one of the panelists who participated in the process and was able to bring the voice of young women and girls with disabilities into the decision-making process. Marcelina is from Samoa. She's a founding member of the Deaf Association of Samoa and served as the vice president from 2019 to 2020. She stepped down to take a role as a staff and remains very active during COVID-19 to making sure that the deaf community in Samoa has access to information on COVID-19. Thanks, Marcelina.
Greetings, everyone. I am Marcelina, and I'm working with my sign language interpreter, Marie, so she will be voicing my presentation today. My name is Marcelina Yuta. My sign name is I am a 23-year-old deaf woman, and I am from a remote village called Satawa, close to where the sun sets in Samoa. Approximately 1.7 million persons in the Pacific are living with some form of disability. According to data shared by the Pacific Island Forum Secretariat, the Pacific Disability Forum has recorded that persons with disability in the Pacific are experiencing many cultural and physical barriers to full participation, as well as lack of access to communities, education, and the workplace. A lack of physical accessibility and stigma towards disability mean that persons with disability are often left out of community life. I work for the Deaf Association of Samoa, which is the leading advocacy organization for persons who are deaf in Samoa. The Deaf Association of Samoa is the only organization in Samoa that is governed and led by persons who are deaf. We have been able to do advocacy because of the support from the Nonua Ole Alofa and the Disability Rights Fund. We work to make sure that the rights of persons who are deaf are protected and supported. My work is very important because as a deaf child living in Rirosabai, I didn't have a lot of access to important things. When I was 4 years old, I started attending school, but I had never learned sign language. I had never seen someone use sign language. My school teacher had a volunteer from Australia for 2 months, was trying to teach me, but my teacher didn't support it. I didn't do good in school for many years because I couldn't understand my teacher. When I was 13, I moved to Apia to attend a school for children with disabilities. And for the very first time, I had the opportunity to learn sign language. I was so confused at the start. I couldn't understand what everyone was saying. But over time, my teachers and my deaf friends taught me sign language. Now, I can speak sign language. I can tell people how I feel when I am sick. I can ask for help. I have the opportunity to study and work. Through my work, I can advocate for my deaf brothers and sisters who haven't had the same opportunity to study and work. At the Deaf Association of Samoa, we work with government, non-government, and community partners to ensure that the deaf have access to health services, churches, school, and work. We held a national forum early this year in which we partner with many NGOs who spoke about gender-based violence, inclusive sports, and women empowerment for when we experience violence. We are currently working with the Office of the Electoral Commissioner to ensure that persons who are deaf are able to fully participate in the 2021 general election. The Deaf Association of Samoa is a part of the Inclusive Education Task Force to make sure that children who are deaf are supported in school. Since COVID-19, the Deaf Association, with the help of sign language interpreters, provided sign language interpretation for health information, on the Samoa Ministry of Health, Health of the Nation program, and states of emergency addresses. This gave our members access to much needed information, and it is the first time that national communication has been translated into sign language during an emergency. We make sure that all of our projects for the deaf are led by people who are deaf. We understand the challenges and experiences, and we understand how to support our deaf community. Through my work at the Deaf Association of Samoa, I had the opportunity to be on the panel of the Resilience Fund. The Resilience Fund works to support young women and girls around the world who are leading positive change. The panel was made up entirely of young women from around the world, and we were responsible for viewing applications and providing feedback on which project we wanted to fund. Some of the projects proposed, including distributing essential resources to communities who are in remote areas and are struggling due to COVID restrictions. Other grant programs to stop gender-based violence or provide information around prevention of COVID-19. All the projects supported under the Resilience Fund are doing such important work. And I am happy that our panel was able to be part of the supporting important change for women and girls around the world. For me, I have learned so much. For being in the panel about the different cultures and experiences of the applicants. But if there is one lesson that stands out for me, it is the challenges that we women face are the same in spite of our diversity. Being marginalized, the target of gender-based violence and discrimination are a few of those challenges we can combat by standing together as women to ensure that no one is left behind. Thank you for listening, and thank you for your time.
Thank you so much, Marcelina. This is Diana. I love the background that you have. I'm very jealous. Wonderful posters behind you, and I really appreciate all of the work that you're doing and how you explained the situation of deaf people and deaf women and girls in particular in the Pacific. I want to next introduce Susannah Phillips, who is the Deputy Director of Women Enabled International, which advances human rights at the intersection of gender and disability. Susannah is key in WEI's work to strengthen stakeholders in addressing sexual and reproductive health rights and freedom from gender-based violence for women and girls with disabilities. And I'm really, really happy to announce that Women Enabled International and DRF are entering into a memorandum of understanding so that we can work more closely together in the next years. Susannah, over to you.
Great. Thank you so much, Diana. And thanks so much to DRF for inviting Women Enabled International to be a part of this important conversation and for the invaluable partnerships that we've been able to forge during this challenging time. Similar to a number of the other panelists, Women Enabled International has had to adapt our work to respond to this unique situation that we're finding ourselves in. On the one hand, we developed a COVID response project to identify and address the specific issues that women, girls, and gender nonconforming persons with disabilities encounter as a result of COVID. And through that project, Women Enabled has had the opportunity to work in close partnership with 7 women with disability-led organizations around the globe to document the lived experiences of women with disabilities during COVID, including the disproportionate and heightened risks of gender-based violence. But we've also found that we've had to adapt and tailor the ongoing projects that we have to ensure that we're able to move forward with those projects in the face of COVID. Right before the pandemic started, Women Enabled International had developed a work plan for a multi-year project with the United Nations Population Fund in their Pacific Subregional Office to ensure disability inclusion across an ambitious agenda seeking to strengthen access to sexual and reproductive health services and gender-based violence services for women and young people across 6 countries in the Pacific region. Our work plan included extensive field research to establish an evidence base to inform the recommendations for the disability-specific initiatives that we would want to implement to strengthen access to these services specifically for women and young people with disabilities in the region. As we all know, lack of quantitative and qualitative data on issues around violence against women with disabilities is a really significant barrier to ensuring disability inclusion in gender-based violence service provision. And so this data collection was an essential piece of our role in the work plan. And about a month after we signed our work plan, travel to the region was shut down as a result of the pandemic. So our ability to carry out this field research that was so crucial to continuing this work was immediately impacted. While our work plan had already anticipated some collaboration and partnership with the Pacific Disability Forum, this new twist required us to be thinking creatively about how we could strengthen and deepen that partnership to be able to continue to carry out the work that we had planned for this multi-year project. And so we're so grateful that we were able to forge a strong connection with the Pacific Disability Forum so that they could provide not just the support and the regional expertise on disability rights in the region, but also to allow us to continue with that research. So while we've been able to conduct some remote interviews from the United States with key stakeholders via Zoom, we really felt that interviews and focus group discussions with women and young people with disabilities, which would be covering sensitive information that is often taboo in the region, which included experiences with gender-based violence, we did not feel that that was something that would translate well to remote conversations. So PDF stepped up to assist us, not only bringing their regional disability expertise to the project, but by working closely with us to implement our plan for focus group discussions and interviews with women and young people with disabilities in 3 countries in the region, to document their experiences with gender-based violence and sexual and reproductive health services. Through this partnership, we've worked in really close collaboration to design a robust data collection project. And PDF and local consultants in Fiji, Samoa, and Vanuatu are helping lead the process of conducting focus group discussions in person, as well as individual interviews to gather the information that we need to inform our continued work in the region. I'm going to ask my colleague, Angie Chand from the Pacific Disability Forum, who I believe was able to join us. She's having some connection issues, so if she's unable to connect, I will offer some additional remarks, but I wanted to pass the word over to her And just a final remark that I'd like to make is that while there have definitely been challenges in implementing this project in the midst of a pandemic, the deep relationships that we've been able to develop with Pacific Disability Forum have really been a silver lining. And we look forward to be able to continue to strengthen this collaboration over the course of the project and to translate the findings of our research into tangible improvements to ensure access to these essential services for women and young people with disabilities. So Angie, I don't know if you're able to hear me and connect. I know there's a big storm in Suva right now, but if you're able to turn on your video and microphone, that would be wonderful. And Angie Chan is the team leader at Pacific Disability Forum and has been our right hand on the work that we've been carrying out in the Pacific for this United Nations Population Fund project. Angie, over to you.
Hi, Susannah. Can everyone hear me?
Yes, we can hear you.
Okay, you can hear me. I cannot turn the video. I think the connection here is pretty bad. Is that okay?
Yes, sure. Go ahead.
If I just talk through. Okay, so good morning, everyone. Good evening from where you are. Greetings from the Pacific Disability Forum. As Susannah has mentioned, we are proud to be part of this initiative with Women Enable International on gender-based violence. And as Suzanne has said, the project is progressing well. For Fiji, we have conducted 2 interviews already, one with women from United Blind Persons of Fiji. And what we found that initially the women said that they don't normally get to talk about gender-based violence. And the topic itself, sexual reproductive health rights, they don't get access to that. The family controls that. So initially, when we did the interviews, it was quite difficult for them to share their experience. The other interview we had was with the Fiji Association of the Deaf, with their women members. They appreciated that we had it in a closed room where information they shared, they knew that was confidential, so they were able to highlight the challenges in accessing information relating to sexual and reproductive health rights. And the one-to-one interviews from the 12 participants from women who were deaf, only 3 volunteered to share their experiences. And mainly because they said the family control, people that's around them don't think that women with disabilities should have access to these kinds of information. So for us, moving forward from the Pacific Disability Forum, this project that we have embarked with UNFPA and of course with Women Enable International will help us to strengthen our work on women with disabilities and particularly strengthen our work on gender-based violence for women and young persons with disabilities. And on the International Day for Persons with Disabilities, in Fiji, we also, with UNFPA, launched the Dignity Kits for women with disabilities. What extra items is needed? And from there, we also identified in this pandemic what extra things are needed to be included in the pack for women with disabilities. So for us, this project is very important, and the findings, as I said, will assist us to improve our work for women with disabilities. Over to you, Suzanne.
This is Diana. Thank you, Angie, and thank you, Susannah, for explaining your joint work together. I am going to invite the last speaker today on our panel before we then pass over to the audience and do a Q&A. Our last speaker is Sophie Pekkor, who has been coordinating the Humanity and Inclusion's Making It Work Gender and Disability project since 2017. Sophie comes from long experience with international NGOs and the UN working in protection and gender-based violence, sexual reproductive health, health education, and disaster risk reduction. I'm also honored that Sophie's work supports many DRF and DRAF grantee organizations of women with disabilities who are addressing gender-based violence on the ground in Africa. Sophie, the floor is yours.
Thank you so much, Diana, and good morning, afternoon, and evening to everyone. I'm really grateful of the opportunity that is given to reflect on past and present actions of the women-led organizations of persons with disabilities and feminist organizations who have been involved in responding to the COVID-19 crisis with the support of Making It Work. A lot has already been said and written on how that crisis has been exacerbating a lack of access to services and vulnerabilities and barriers everywhere in the world. So I shall not repeat those. Making It Work partners work at the intersection of gender and disability, meaning that they are using the tools, the human rights instruments, the policies and the plans in place in their countries and regions and counties and sub-counties to make sure that disability is taken into account in gender and GBV efforts. And similarly, that the gender perspective is articulated in those mechanisms initially designed for persons with disabilities. When a crisis hits, progress that has been achieved with so much work and energy is stopped. Progressive and inclusive mechanisms are put aside. And what we've seen is that the need to provide for a large number of persons is pushing back the diversity of human beings, making the less powerful of them invisible. So those at the intersections have to shout even louder. But enough of theoretical talks. What have been the achievements of Making It Work partner organizations responding to COVID-19 crisis? I am presenting here elements from projects that were run by LIDWA, Lira District Disabled Women Association in Uganda, and COVO, Coalition on Violence Against Women from Kenya, KEFEADO, this is Kenya Female Advisory Organization, UPHB, which is Union des Personnes Handicapées du Burundi, so Union of Disabled People of Burundi, Women Challenge to Challenge Kenya, Mubende District Disabled Women Association in Uganda, and last is Cameroon Baptist Convention Health Services in West Cameroon. So our partners have been extremely reactive in trying to address the twofold safety issues faced by women with disabilities. By twofold, I mean that they were being at risk of getting affected by the virus with difficult access to prevention items and sensitization, and that they were facing additional and increased risks caused by the repercussions of society's efforts to stop the virus spread. Our partners did a lot to try and address prevention and response to GBV. They have been trying to break the isolation of women with disabilities that was paramount during curfew and lockdown situations. And to do so, they have been setting up toll-free helplines for women to be able to call, alert, and report using calls and SMS. They have been distributing airtime to isolated women with disabilities. They have been talking about GBV against women and girls with disabilities on radios, on TVs, in many languages. They have been conducting door-to-door and outreach visits to small groups of women to deliver the prevention messages. They have been supporting women survivors for them to access health centers and to report about cases. They have been supporting case management for women and girls with intellectual disabilities. And last, they have been helping the existing women's shelters, the ones that were still open, for them to welcome women with disabilities, despite a lot of resistance. On access to SRH, our partners have been providing financial support to ambulances to transport expectant mothers to the health center for them to deliver. That was in northern Uganda, for instance. They also have been providing sanitary materials to women and girls and to their caretakers in many places. Those activities, of course, were supported by strong advocacy to ensure that women with disabilities were integrated in government-led distributions and social programs. In Kenya, in particular, advocacy was conducted in a very collective and powerful manner. Also, there is no GBV programming without economic empowerment and financial autonomy. So our partners have been providing women entrepreneurs with economic recovery packages for them to restart their activities as soon as possible. So as always, with making it work, financial and technical support go together. This COVID-19 crisis has been the occasion of a very intense cooperation between the project team and the partners. And I want to thank them a lot for having been so reactive and flexible and allowing our project to continue being useful in that very particular period. So really thank you, sisters. Last, let me take the opportunity to share that the Making It Work project has just published its new report, where you will hear more about 8 successful good practices addressing violence against women and girls with disabilities from Burundi, Kenya, Mali, Rwanda, and Uganda. Thank you very much.
Thank you, Sophie. I'm going to hand over to my colleague Faith for the Q&A. Faith, the floor is yours.
Thank you, Diana. This is Faith Lemon. I'm the Program Director for the Disability Rights Fund and Disability Rights Advocacy Fund. And I'm so honored today to be facilitating our audience's questions to this League of Extraordinary Women that we have with us today. So we're going to start with one from Amanda, who hails from Women Enabled International, which is one of our partners on this webinar and in general. She has asked one starting with Milani. You and the team at HDI are doing amazing work during this crisis. I wonder, are you or any of the other panelists seeing any good practices in preventing or responding to GBV against women and girls with disabilities during this pandemic, or in ensuring other rights, for instance, sexual and reproductive health rights? So Milani, would you open up your mic and your video and share a few ideas?
Yeah, thank you, Faith, and thank you for the question, Amanda. Like I wrote in the in the response of your questions on preventing and responding to GBV during the pandemic. So other activities like the other activities, except the activities that I shared through the presentations. We also train the branches. HWDI have 34 branches in the provincial level, and also we have 95 branches in the sub-district level. So we train them to understand what is the gender-based violence. So to be honest, not everybody, not all persons with this, not all women with disabilities, especially HWDI network, understand about the gender-based violence itself. So how they identify the gender-based violence, and then who they can contact to if somebody or women with disabilities around their life coming into the organization and ask for assistance, ask for help, ask for advice. So we train them to be able to face this kind of situation, because it should be a lot of victims coming to the HWDI, because in the sub-district level, this is quite a few of organization of women with disabilities that can, although we are not specialists, we are not the professional, but we have to force ourselves to be able to assist them. So yeah, we train them. We use the expert of the women with disability expert. I think we have a lot of women with disability expert, and as well as from the women movement itself. They are very familiar and really support the movement of women with disabilities. So that is one of the effort that we did during the COVID-19, to be able to assist the victims who are living in the rural area. And also we are able to reach and giving this kind of training through the 95 sub-district, because we do it in online. Usually before, we think is the capacity building is always on site, and for Indonesia, providing capacity building or training on site is very expensive, because we have to bring them between lands, because Indonesia in archipelagos, so it's quite expensive. But now we learn, and then we are introduced by the cheaper communication by online. I think that's one of the blessed in disguise in the situation of pandemic. Thank you, Faith. I come back to you.
Thank you, Milani, and I will hand it over to Angie now in Fiji, if the rainstorm is cooperating for her to respond to this question. I think that she can provide some useful examples. Okay, looks like the weather is not cooperating after all. So we will move on to our next question, which is from Eliona, a PhD candidate who's researching violence against women with disabilities in terms of access to justice. And she has asked, what are your governments or your organizations doing with regard to supporting women with disabilities within the justice systems when it comes to reporting and investigating and prosecuting the violence that they have survived? So we will start with the Kudans from Rwanda and go from there.
Thank you, Eliona, for your question. This is a good question. Sincerely, there are so many barriers when it comes to access to justice for girls. So what are we doing? They are accessing justice. UNABU, the Rwanda organization of women with disabilities. We currently have a space where we established the coalition, not only as organization of women with disabilities, but also we joined our effort with the other civil society organization in a coalition where we have women's rights organization, and in addition to another organization, a network of legal aid provision civil society organization. We are advocating for accessible justice. The way we do our advocacy is making sure that we engage with our government. And this year, our government established Disability Inclusive Justice Strategic Plan as a result of our advocacy, so that the strategic plan recognize what are the barriers, but also what are the key activities, the key initiatives, the key stakeholders will be involved to make sure that persons with disability in general, and specifically girls and women with disabilities, can access justice. But also from the Global Disabilities Summit, our government recognized that girls and women with disabilities are at the higher risk of violence. And there is one commitment where the government committed to making sure that Isange one-stop centers, those are the centers specifically supporting victims of violence, where you can get investigation person, you have the doctors, you have social workers, psychologists when you are a victim, and then you are supported. So the government committed to making sure that those centers are accessible, but we are working with the government and the Isange one-stop centers, where we by now trained 39 staff from those Isange, including investigation, psychologists, doctors, to make sure that they are aware on the disability mainstreaming, how they can effectively support victims of violence, regardless their types of disabilities, mental, intellectual, psychological, physically. They can really support them, because most of the challenge that we are seeing is capacity of professionals within the justice system, how they can effectively support persons with disabilities who are seeking their support. So we started by training them on disability mainstreaming, but also we are currently assessing all those Isange one-stop centers to make sure that we know what are the challenges, what are the barriers, what are the gaps at the level of each and every Isange one-stop centers, so that the government will put in place an action plan to address all those gaps that we come up with. Thank you.
Thank you, Gaudence. I think that we are all very excited about your work with the one-stop centers as a really compelling example of the advocacy around the Global Disability Summit commitments. So thank you for sharing. And I think we're going to end the Q&A with a response from Marcelina to this particular question about what the governments and the organizations are doing regarding this issue. Take it away, Marcelina.
Hello, thank you for the question. In our organization, we are often consulted by the police to provide sign language interpretation for the deaf women who are affected by violence. And we are also working closely with the Ministry of Justice in this area. Our NGO, we are often also consulted to support women with disabilities, especially intellectual disability, to advocate to ensure that they are able to navigate justice system. We often refer them to Samoa victim support for refugees, and we often have to mitigate difficult situation with the families.
Thank you. This is Faith again. Thank you, Marcelina. And at this point, it has been a very robust and informative conversation, but it is time for us to let everyone get back to their morning, afternoons, and evenings. Thank you everyone for joining us today. At this point, I'm going to ask all of our esteemed panelists to turn their videos back on to say goodbye. And we will be following up with some resources, some of those that were presented by the panelists today in order to share some of their good practices. Thank you, everyone.
Thank you all. Goodbye.
Thank you, everyone.
Yes.